It's not a matter of finding what's wrong with you. It's a matter of finding what can improve. Weight loss should be the wonderful side effect of restoring your health, not the goal itself. So just changing that frame of mind, saying we're going to look at your blood work and say, our objective is not to lose weight. Our objective is to restore your health. Why does the greatest basketball player or golfer in the world have a coach? Because they can get better, right? So it's not a matter of finding what's wrong with you. It's a matter of finding what can improve.
In Progress podcasts.
People call me Dr. Stephen G, and that's my handle across every social media platforms at DrSteveng on everything from Instagram to Facebook, which are my two largest platforms, but also X and LinkedIn.
Very cool. All right. Just to make sure, in my researching, you've been at this for over 25 years?
Yeah, I've been practicing now for what will be 30 years this summer. So yeah, it's been quite a run. I graduated chiropractic college in Dallas, Texas from Parker University in 1996. And immediately after graduating, I signed up and got accepted into a 3-year postgraduate neurology program. And I started seeing patients. My main focus was understanding the brain and central nervous system. I had always had a family chiropractic practice in that first decade of practice, but I also had about 20% of my practice was specialty based on brain-based disorders. So I worked with everything from children who had developmental challenges and senior citizens with early Alzheimer's and Parkinson's. I worked with stroke and everything you can imagine that's brain-based in between, but really started to settle after about a decade in practice on sports concussion. Whenever you work with brain-based challenges that people have, you always quickly understand that they also have metabolic concerns. So very early on in the process, metabolic health and blood chemistry became very, very important to me. And I developed an expertise and a significant amount of postgraduate work in understanding blood chemistry.
Very cool. Quite a path.
Yeah.
It doesn't sound boring at all along the way.
Not boring and certainly unique within my profession, while there are others who are a lot like me. If there are 60,000 licensed chiropractors in the United States, a small handful of us, I would say there's, I believe worldwide, 700 plus people who are diplomates of the American Board of Chiropractic Neurology. I got that through the Carrick Institute. And then those who had pursued further education in understanding metabolic health and blood chemistry are probably fewer than that. So I'm a unique commodity within my profession and have been used by other people in the chiropractic profession as a resource. So I've spent a lot of time on stage speaking around the country, around the world.
Okay. So something you keep bringing up here is the chiropractic neurology. Can you explain a little bit more on that as how that's different from, say, standard chiropractic, or seems to be so many different styles out there. What is chiropractic neurology specifically?
Yeah. So first of all, it's not different. The basic premise behind the chiropractic profession for 130 years is very simple, and it's a principle that will never go away. And that is the nervous system is the master system, the system that controls all the other systems in the body. And anything that would interfere with the optimal expression of health through the nervous system is something a chiropractor would like to identify and remove. That interference from a physical standpoint is usually at the level of the vertebrae. Have, vertebrae that descend, the central part of your spine. And in between each of the vertebrae, you have nerves that go out and control everything. So if there's any structural abnormality, then we would want to correct that structural abnormality in order for the body and the environment in which it's in to communicate as effectively as possible. That's the basic premise of 99% of what chiropractic care is about. What the chiropractic neurology says, okay, you graduated, you have a great understanding of structural health and how it relates to the nervous system, but let's do a deeper dive in understanding the central nervous system in more detail. And perhaps there are things that we can understand about the function of the brain that can allow us to intervene in a way that is more directed to a specific problem that a person is having with their nervous system.
So maybe a little more specialized and a little bit more just directed down in that.
Yeah, we'll use different diagnostic tools. So for example, I have work quite a bit with video nystagmography, which is a way of looking at the vestibular system. The vestibular system is very, very important to the function of the entire brain and is very much tightly related to how information comes in, specifically from our muscles and joints.
I'll interrupt you there just for a second because I know what the vestibular system is because I've been talking to many different chiropractors and different people, but I feel like that's not necessarily a term that too many people know.
For sure.
So if you would elaborate on the vestibular system and explain that in a way that most people can understand, I'd love to hear it.
Yeah. So if you think about the vestibular system is the body's way of telling you where you are in space. I can hold my arm out here and I know the exact position of each of my fingers without looking at them because there's a feedback mechanism that tells me about where I am in space. And this holds true consciously and subconsciously. Now, there are, the vestibular system is kind of a three-legged stool, requires muscles and joints to tell you about where you are in space. So there's a kind of a 24-hour gravitational stress we have that compresses our joints and allows our muscles to stretch in a way that that feedback is present. The second part of that stool is going to be your eyes, right? I'm sitting here and I kind of want my eyes to be level with the horizon. So if I have a head tilt of some sort, if I have a head turn, I kind of understand that there's a positional change. And then there's a liquid-based system in your inner ear that, kind of tells you about very delicate motions that your body will have. And if you could imagine, if I'm tilted this way, let's say I have a scoliosis, I'm tilted this way, there's a mechanism that the body has that tells me that I'm tilted, and therefore I'm going to activate certain muscles to prevent me from tilting over and falling over. Anyone who drank too much alcohol in college knows that if you impair the vestibular system by drinking too much alcohol, you start to get the spins, you get kind of vertigo, and that's that system run amok.
A funny thing on that, as a pilot, you're learning to fly. One of the things you have to teach yourself is to not pay attention to that.
That's right.
Trust the instruments. You start getting, we'd call it the leans. And then you're like, okay, the plane's flying level, but just never felt right. But yeah, that whole spatial awareness that even coming from an AI background with a lot of the humanoid robots, that is really hard to really either program in or to lock in. But I also remember going down a rabbit hole one time with that in regards to Parkinson's and how that vestibular system is crashing down on them. And that's why Parkinson's patients have so much control problems.
For sure. And when it comes to the vestibular system, it is so metabolically active. So when I say the word metabolically active, your listeners can just basically say the hardest working parts of your body are going to use the most fuel. Your entire brain is 2% of your body weight, but it can use up to 30% of your oxygen or your fuel. That entire central nervous system and brain, the vestibular system, is the most active part of that and the most oxygen sensitive. So the vestibular system is really, really important in gathering information about your environment and then taking that information and distributing it to the rest of the cortex, right? So you're going to send that information about the environment. It's going to feed forward to all the higher centers, right? Those that make us human, right? Our frontal cortex, which gives us our executive function and our personality. All of the higher centers need a constant flow of information from the environments, kind of like a windmill creating energy for the entire system. So this system is also very, very much tightly related to those central joints and structures of the spine. So when we talk about the human spine, the most neurologically active part of the neuromuscular skeletal system, everything from your fingers and toes all the way up to your neck, the more central it is, the closer it is to your spine, and the higher or the closer it is to your brain, the more active it is. So the chiropractic profession is really built on this maintenance of proper position and communication of joints, muscles, and tissues to have a free flow of uninterrupted information. If that information gets interrupted for whatever reason, there's many reasons that could happen. A chiropractor can look at the posture and structure of the spine and say, if I improve this, then that entire system, meaning the entire brain, could improve its function. And this is why chiropractors for 130 years have understood that chiropractic care is not about low back pain. Chiropractic care is not about headaches and neck pain. Chiropractic care is about, there's virtually almost no condition known to man that somebody hasn't benefited from in a chiropractor's office.
Yeah, I've had a strong lecture given to me about the importance of the Atlas and not taking one of those impact guns, like for muscle pain. I had a pain in my neck and put that like right on the muscle back here. I woke up the next morning and went straight to my local chiropractor's office and got my butt chewed for it.
Right.
He's like, "You did what?" I'm like,
Yep.
"It felt good for a minute." But so this is genuine curiosity here, because as an engineer, AI software guy, I think of things as electrical. And then I also go, if you put pressure on a wire, it doesn't really affect the wire. But if you put pressure on a hose, you're going to affect the hose. So is it more of is it an electrical system? But then it's also talked about like the flow. How does that work? Like, part of me wants to go, which is it, electrical or like a fluid flow or something like that?
No, it's such an interesting question. So the nervous system is not like copper wire. The nervous system will allow information to flow through the nervous system through neurochemical reactions that occur across membranes, giving it that electrochemical quality. So yes, there is a conductance that occurs, but it is biochemical. So it requires there to be blood flow. It requires there to be electrolytes. It requires there to be certain charges across membranes. So it's biological and electrochemical all at the same time.
So yes, it can be squeezed like a pipe or a tube and that affect it, but also it's still an electrical signal. Yeah. Okay.
So now just imagine, so let's use again, I'm dating myself. I'm an old guy. I don't think there's anyone under the age of 50 who knows what a telegraph was, but just imagine using Morse code on a telegraph, and there would be something that would prevent some of those dots and dashes from being communicated to the other end. What you're going to get is gibberish on the other side. The world around us, right? Bodily position, our surroundings, our temperature, our bodily position, our temperature, all of these things are being fed into the nervous system to tell you about your awareness of where you are. Why is that? Well, because your brain has no idea. Your brain is enclosed in this completely dark space, skull, floating in a fluid. It has no response to gravity. It has no response to light. It has no response to sound. It's completely temperature protected at 98.6 degrees. Whether you're in Baghdad in the summer or in the Arctic in the winter, it is a fully protected system. And therefore, in order to know what's going on in the world around you, you need receptors. And the receptors are in your eyes to tell you about the light around you. The receptors are in your ears telling you about sound. The receptors are on your tongue telling you about taste, and on your fingers for touch. However, the overwhelming majority of the receptors that we're talking about, when I say overwhelming majority, north of 90% for sure, are your receptors that respond 24 hours a day to gravitational stress. That's going to be your joints, your muscles, your tendons, your ligaments. Each of those are sending a message, kind of like an orchestra, conducting the information into the central nervous system. The central nervous system can then respond appropriately to changes in that environment. So if I were to apply scientific terminology to the chiropractic philosophy, the philosophy is the greater the awareness of your surrounding environment, the greater the adaptation, because ultimately to be human and healthy is to be able to adapt to changing environments.
Cool. So in that pursuit of greater awareness, greater functional health, chiropractic helps alignment, but that's only part of it. You've talked about metabolic health, metabolic needs of the brain. I'm assuming even your spine and your nervous system has a metabolic demand on it to maintain that biochemical connection we were talking about. So with you and your experience here, can you explain some more on how metabolic health and blood health or
Mhm.
blood chemistry really plays a role in that whole total awareness and total genuine health?
All right. Now we're talking. So if I go off on a long tangent, please feel free to interrupt. But the way I like to explain it is this. We're asking the central nervous system and the environment to respond as appropriately as possible. And if there's an impairment of that situation, there's going to be some kind of symptom that a person is going to experience, they're going to seek help. If a chiropractor is going to provide a chiropractic adjustment in a way that allows the central nervous system and the body to communicate better, that means by definition, the central nervous system is going to demand more fuel, right? It's going to want to better adapt to its environment. All right. So why do I say fuel? I say fuel because remember, we are an electrochemical system, which means those cells that in the central nervous system that are so metabolically active, like I mentioned, it's using, a third of your fuel and it's only 2% of your body weight. Well, then if there's anything impairing the delivery of that fuel, you're not likely to benefit as much. So for example, something as simple as anemia. Anemia is really a problem with your red blood cells. And there are many problems. There are many different forms of anemia, probably a dozen major forms of anemia and probably three dozen minor forms of anemia. But anemia just basically means that the red blood cells are not doing their job. The job of a red blood cell is very simple: deliver oxygen. And just like an automobile needs two aspects of fuel to function, an automobile needs air and gasoline. And those two things combust in the engine and out, that produces energy called horsepower. And out of the tailpipe comes some pollution. Your brain cells and all the cells in your body are almost exactly the same as that, meaning the oxygen and the carbon, or, that could be in the form of glucose, that could be in the form of fat, that could be in the form of lactate. But anyway, let's just use glucose. Oxygen and glucose come into the engine of the cell. We call that engine a mitochondria. It produces energy that we call ATP, not horsepower, and it generates some pollution out of the tailpipe called oxidation. So now, if I have an impairment of the ability to get that oxygen into the cell, I can adjust you and you may not benefit as much as you should because your nervous system is demanding more fuel and it's not being delivered. So looking at blood work, we can assess if somebody has a very basic nutrient deficiency that could explain poor oxygen delivery. Something as simple as vitamin B12 or folate or even iron could easily be recognized on a very simple $3 blood test called a CBC. Now, that's just one basic example. There are many other examples of how fuel can be impaired. So the other half of that equation, the first half being oxygen, the second half being glucose, if you're insulin resistant, like 1/3 of American adults are, well, now you're going to impair the flow of that gasoline, right? You're going to impair the flow of that. So looking at blood work is very, very important. Now, we don't look at blood work the way a medical doctor does. Although, yes, we're fully responsible to pick up pathology. Once we've ruled out pathology, well, then we're looking at physiology. So we look at blood work a little differently. So let me illustrate that for a second. If an orthopedic surgeon is going to look at an x-ray of your spine, chances are that x-ray was taken with you laying down on a table. They take an x-ray and they want to rule out fractures, dislocations, tumors. In the absence of anything to fix in the surgical room, you should be fine. A chiropractor gets 3 years of radiological training, and we're responsible to pick up those same things. We're responsible for identifying a fracture, a dislocation, a tumor. But in the absence of that, we usually take our x-rays in a gravitational stress. We're looking at the rest of the spine a whole lot differently than an orthopedic surgeon because our way of intervening is far different from an orthopedic surgeon. So when we look at blood work, it's the same thing. Your medical doctor is responsible to pick up the disease process, right? Leukemia and things like that come up on blood tests. But so are we. If I'm going to order a blood test, I have to be responsible to find out if there's something pathological that needs a referral. But then in the absence of pathology, if I can tie that person's fatigue or that person's inability to hold a chiropractic adjustment to poor oxygen delivery because of their CBC, well, I'm going to look at their B12, their iron, their ferritin,
Yeah.
these other markers, their folate, and say, okay, if these things are insufficient or deficient, let's provide a plan that gives them sufficiency so that they can benefit from the care that they're getting in the office. Chiropractic care is, from a blood chemistry standpoint, has to be in line with the chiropractic principles. We're not just trying to become medical doctors, which we're not trained to be.
Yes. That's kind of, so not only are you looking at the medical side, looking at what, say, my family doctor would be looking at, you're also going beyond that. Okay. Not just how do I make you not sick anymore, but how do I make you better? You mentioned insulin resistance. Is that I want to say like a metabolic disease, or it's a condition? How much of that do you actually see when you start looking into blood work? Say, if you were to take 100 blood panels, how many of those people do you think you'd be like, oh, hey, they have some kind of metabolic disorder or metabolic problem out of those?
Yeah, 90%. 90%. I've done over 10,000 labs over the last couple of decades, mostly in the last 10 years.
Is that because generally people are coming to you that are going, hey, I'm not doing well, I need to get better? Or do you think, like, across the board, if you took 100 random people, you'd still find something with 90% of them?
In 2018, the biggest study done on this was the NHANES federal study that looked at the American population. And it basically stated that 88% of the American public is metabolically unhealthy. So, that tells you a lot. Now, I will tell you also that it doesn't matter how young and healthy and beautiful somebody is. A perfect example is Division II hopeful in high school, female track athlete, not a complaint in the world, not a symptom in the world, looking, to just get checked, gets her blood work done, and she's grossly anemic, among other things. And she's a long distance runner. The only health issue she ever had in her life from the day she was born was some shin splints that would get in the way of some of her training. And we did get to see some deficiencies and insufficiencies and in some ways toxicities that were easily resolved. And then she went from a Division II hopeful to a Division I superstar. So you don't really know, why does the greatest basketball player or golfer in the world have a coach? Because they can get better, right? So it's not a matter of finding what's wrong with you. It's a matter of finding what can improve. And then, of course, let's just take the other end of that spectrum, and let's say somebody calls me and they have terminal cancer. They 6 months to live, and they're getting radiation and chemotherapy, and they come to me. I'm not an oncologist. It's not my job to treat their cancer, but if I see something in their blood work that can certainly improve their health, that would give them a better experience while they're still here, well, then I'm going to do that. That's my job. If the sickest person in the world has a insufficiency or deficiency or something that can be easily corrected through lifestyle change and or nutritional supplementation, usually both, well, then I'm going to make that recommendation. That doesn't get in the way of what her other doctors are doing. So it's important to understand you can always make your health better.
I remember years ago, I had a friend of mine, as I was in heavy training, and I was on the power lifter, not the bodybuilding side. I wasn't eating celery all day, flexing in front of the mirror. I was trying to pick things up and put things back down. And I was talking with another guy, or actually a girl. She was a runner, and we were talking about health and fitness and things like that. Like you said, like, she was like as skinny as a rail. But I was very surprised as, like, yeah, she was all slow twitch, no fast twitch muscles, and just generally, like, she was always sick. Like, "Oh, I got a cold. Oh, I got a cold." And it's like, I'm as you can see, I'm not a small guy in any measure. I'm larger now than I want to be, but that's part of the process. That's part of where I'm going,
Mhm.
and I'm working towards that. But I also look and I see unhealthy people that look fit, that are the, I don't want to say the skinny fat, the skinny unhealthy. And then a trend that I feel like is happening more and more now is the idea that obesity is genetic. I don't know how genetic it actually is. There's part of me that goes, there's a certain amount of genetics to it. There's also a certain amount of the average American diet is pretty crap. For you and your experience, I see you nodding to yes, there's the skinny, unhealthy people.
Yeah.
And those aren't as obvious. And you have the 300-pound, I'm not healthy, I need help. How far off do you think their genetics, so to speak, are? And how much of that do you think is actually still lifestyle, diet, and nutrition?
Yeah. So, we have to be careful to when somebody comes to me and they say they want to lose weight. There's a lot of ways to lose weight. There are very, very healthy ways to lose weight. There are very, very unhealthy ways to lose weight. So the weight loss is an aesthetic thing. I want to look better in clothing. Now, people will then say, no, 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 obesity is a health problem. And yes, it is a health problem, but it's correlated with health problems. So very tightly correlated with health problems. It's hard to find an obese person who's healthy. Very hard. But weight loss should be the wonderful side effect of restoring your health, not the goal itself. So just changing that frame of mind, saying we're going to look at your blood work and say, our objective is not to lose weight. Our objective is to restore your health. Part of your health problem is insulin resistance, and it's contributing to your inability to burn fat and your ability to store more and more fat, and all of the inflammatory processes that go along with that. And if we fix the metabolic problem, well, then by becoming healthier, you'll become the weight that you genetically probably should be. We can't sit here and say that the picture of health is a six-pack abs, right? That's kind of what you want to look like when you take your shirt off at the beach. It's nice, but genetics will certainly dictate some of that. And when you see somebody with a six-pack abs, they're more often healthier than the obese person, but they may not be metabolically healthy just because they look good. So I will tell you that my behavior when I was 19 or 20 years old was the furthest thing from healthy that you could even imagine. I remember being a bartender in college and drinking alcohol the whole night that I was working, and then go to a diner in Queens, New York, and at 4 o'clock in the morning and eat 5,000 calories of
Fried potatoes?
yeah, French fries, gravy, mozzarella cheese, and a double cheeseburger deluxe. Go to the beach the next day, take my shirt off, and not be embarrassed. Well, I can tell you at 55 years old, I can't do that anymore. I have to be more diligent, because no matter how good your genetics are, over time, abuse is abuse, and the system is going to wear out. Now, there are people who genetically at 19 or 20 years old behaved the way that I did, and they did become obese and they did gain weight. And yes, there is a genetic component there. To sit there and say that something is entirely, the only diseases that are entirely genetic, we know them, Down syndrome or things that are very, very specific. Now, are there polygenetic, manifestations of disease that make it more likely for you to experience that disease in the presence of unhealthy lifestyle? Yes. But change the unhealthy lifestyle and you may not be expressing that disease that may run in your family.
So this might be a little bit more of the poke the bear kind of question. GLP-1, is that a good tool, or is it shortcutting the discipline you should have?
Well, it's clearly shortcutting the discipline that you should have for sure. But if we look at it population wide and we look at the health problems that our country has, as many of the side effects as there are, and there's a lot of predictions about what we're going to see after a few decades of using this class of medication, I have no doubt that many of those predictions are going to come true. In the short to midterm, it's going to go a long way in taking care of some of the other problems that we have, right? There will be probably fewer open heart surgeries or fewer open heart surgeries in people at younger and younger ages. There'll probably be fewer knee replacements at younger and younger ages. I mean, these are statistics that have been wildly going in the wrong direction. And anything that's going to stop that doesn't mean that we're healthier. It just means that we can save a lot of money by addressing obesity with a GLP. Yes, there's going to probably be more fractures associated with poor bone density. There's going to be more frailty because of the muscle loss. There's going to be possibly some brain effects that we're just not aware of just yet. Sure. And those are going to have their own expense tied to it. But if I were looking at population-wide policies, which is why I don't live in, I'm not a government official and I don't get involved in that nonsense. But if I were working for the CDC and I was an advisor for health policy, yeah, I'd want to make these drugs cheaper and more available. And we can figure out ways to save us a ton of money on procedures that we're doing now that could be prevented by people not being obese.
And not just the financial savings and the strain on the system, but also, I don't know anybody who has gone through open heart surgery and has been fully healthy afterward. Like, any major surgery is invasive and destructive, even though it may be saving your life or helping you there. It's still a major surgery, and there's so many complications with it.
I mean, just think about it. What is the need for open heart surgery? For the most part, is some kind of blood vessel disease. And because we addressed the one that is going to take your life out, the widowmaker artery that needs to be bypassed, saves your life. But you've got a lot of other blood vessels that have experienced damage as well. So the blood supply to your brain in other blood vessels, those blood vessels are not healthy. It's not like just one artery becomes unhealthy. The rest of them are totally healthy, and you can't bypass all of them. So yeah, by the time you need open heart surgery, you've had over a decade, probably 2 or 3 decades of metabolic poor health that could have been picked up easily on routine blood work if the routine blood work wasn't so pathology based. If we could, insulin resistance, you don't have to have pre-diabetes to have insulin resistance. Matter of fact, your A1C can be 5.2. It could be completely normal. Your fasting glucose can be completely normal. But there are other manifestations that happen first before you develop insulin, before you develop pre-diabetes. People think, ooh, I was told I have pre-diabetes. I better watch out because I might one day get that horrible disease called diabetes. Well, no, pre-diabetes is a disease on its own. You don't ever need to get type 2 diabetes to experience the ill effects of the disease called prediabetes. It is a disease. Liver enzymes rise, triglycerides rise, inflammatory markers rise. All of these things are happening way before your A1C or your fasting glucose goes up. Reading blood work in the medical model is just, all right, everything looks good. We'll see you in a year. Everything looks good. We'll see you in a year. 5, 10, 15 years go by. Oh, look, we found something. Take this pill. Well, now you have a disease. Like you waited until a disease process showed up. That blood work is such an amazing tool to show people how they can make changes right now that can fully reverse that outcome. But instead, we use the annual physical, that nonsensical process that we have people go through once they get married, I guess, and have kids. I had my first annual physical, which I only did once, when I needed to get insurance because I just got married and had a child and I needed to be a responsible adult. But the outcome, the overwhelming outcome of the annual physical, which is a joke, it's an absolute joke, is getting people in their early 30s on polypharmacy, meaning the first thing they get is a blood pressure pill and a statin drug. And that's it. That opens the door to a lifetime of polypharmacy. And 10 years go by, oh yeah, everything is great, doc. My blood pressure is good and my cholesterol is good. You've been taking these toxic drugs from 32 to 42 years of age. Totally unnecessary. It was 10 years wasted of, being educated to do something for yourself. Now you got me on my soapbox.
Well, I might be keeping you up there for another moment here because in seeing labs on people, I know coming from training and like being in that kind of mindset, I would do labs every 3 months. And I could see in my own life how things were changing. From your experience, I wonder what kind of labs do you see in different people, i.e., like, say, someone who's going carnivore or
Mhm.
keto, the intermittent fasting people, you have the plant-based only people. I'm sure you see that whole gamut. What do you see in that blood work? Do you see any trends or anything like, hey, this works, this is a bunch of bull crap? I mean,
Yeah. So again, blood work is a photograph in time. The more data points you have, the more information you have, and the more you know about the person you're looking at. You're getting the blood work on, the better, right? Like what their habits are, what their fitness habits are, what their dietary habits are. And there are some things that you would expect from a vegan, and there are some things you would expect from a carnivore. For example, in a carnivore based diet, you might see dramatic elevations in LDL cholesterol, but you might see dramatic reductions in triglycerides and A1C and inflammatory markers. So, one of the things I like to talk about when it comes to cholesterol is, and again, this is oversimplistic, but directionally accurate, but it helps people visualize what's going on. And I always say LDL cholesterol is to heart disease or blood vessel disease as oxygen is to fire. You can't have blood vessel disease without LDL cholesterol. You can't have a fire without oxygen. Now, you and I are both in a room filled with oxygen right now, but we're not in danger of bursting into flames. If the room I'm sitting in had a lot of bales of hay and I was indiscriminately flicking matches around the room, I've significantly increased my risk of suffering from the effects of too much oxygen in the room by causing a fire. Clearly, the oxygen didn't cause the fire. It's it's necessary, but not sufficient to cause the problem. In order to have a fire, you need three things. You need a spark, you need oxygen, and something to burn. In order to have heart disease, you need LDL cholesterol, inflammation, and immune response, and insulin resistance really just lights the spark. So all of those things are present. And if you reduced all of those factors, but the LDL cholesterol remains elevated, well, then there's things you can do to follow that person's life and their health to make sure they don't have unnecessary coronary artery disease. That basic, I don't think there's an argument that people are trying online to say, LDL cholesterol doesn't mean anything. Well, no, it means something, but LDL cholesterol doesn't mean everything.
yeah,
So when you look at somebody's health, you don't look at a single marker. There's nothing about the human body that's singular or linear. It's a web of physiology. And as best as you can understand that web, the better you can understand how to advise the person sitting in front of you.
it's funny you say that LDL cholesterol. I'm like, yeah, I'm pretty sure, like, as a single marker, they got a medication for that too somewhere, and that will bring that down. But like you said, it's not a single item; it's multiple items. So, seeing how most of us are in a poor metabolic state, I will say myself right now, I'm in progress, in a journey of
Mhm.
restoring my metabolic health. And I have had the lab works. I am working directly with a doctor here in Charleston that is working with me on these different markers and different things. But as a general statement, knowing, hey, everyone's different, everyone has their own things, looking at your experience, we kind of mentioned the carnivore and the vegan, two completely opposites. And my mindset, I kind of fall a little bit more in the middle, but I wonder from your experience and from what you've seen, someone trying to restore their metabolic health, what would be, hey, I don't know anything about you, but if you
Mhm.
did this, this, and this, these are likely to be the most beneficial things for you to do.
So on the vegan side, I have a couple of stories. One story, there are two people that I met in my entire 30-year career that I did their blood work, and they were vegans. One of them this was interesting. She was referred to me through a friend, and she didn't have a complaint in the world. She was in her mid-30s, had a couple of children. She's like, if I had something to improve, I probably want to lose 8 pounds, but I'm really not complaining. Right. She had absolutely no complaints whatsoever. Family history was great. Personal history was great. Just, she goes, I know the advice you've given my friend and the advice you've give to others. I'm telling you, because of my religion, I'm 100% vegan and I focus on grains. And I'm like, oh boy. So I know what I'm going to see here. I'm going to see iron deficiency. I'm going to see, insulin resistance. I'm going to see a whole bunch of stuff. I didn't see any of it. Matter of fact, it was one of the best panels I've ever seen. Everything was like spot on perfect, right? And I ran into two cases like that. The overwhelming majority of vegans, when they decided to become a vegan, they usually decide to become vegan because they're sick and tired of being sick and tired and on the standard American diet. When you go from the standard American diet to any discipline, call it a diet, but it's a discipline, you're going to see dramatic improvements. You can go on the potato diet, the Miami diet, the vegan diet, the carnivore diet. It doesn't matter. When you apply a set of rules to your life, when there were no rules before, dramatic improvements. And depending on how old the person is, those improvements, and my experience in the vegan world is, the first 5 years were great, especially if you started when you were 18, 19, or 20, when you started to feel sorry for animals. But then, a decade goes by and you're not looking so good and you're not feeling so good. And that's been the majority of my experience. Again, there are exceptions across the board on everything, but that's been my overwhelming majority of vegans wind up very unhealthy. And the overwhelming majority of carnivore people who, these are the most health conscious people you want to meet. They work out like fiends. The beef is grass fed and hormone and antibiotic free. They're buying the best quality cheeses and I'm seeing incredible results for these people, even those who are my age. So when you're conscious about what you put into your body, regardless of your philosophy, you're going to see benefit early on. It's the long-term strategy that I'm interested in. How is this affecting you 5 years down the road, 10 years down the road? And, we're starting to see a lot of a lot of carnivore people who've been doing it for 5, even 10 years. They're doing fantastic. More than you would expect. Whereas with the vegan lifestyle, I'm seeing more metabolic problems than I would expect. So I lean towards the carnivore, especially since personally, I benefit from that lifestyle as well.
I remember when I was training, I was aiming for 250 to 300 grams of protein a day, which just turned out to be a lot of steak to be chewing. For after the surgeries, after this year, and all the crap I've been through, I have gone towards a very heavy carnivore with green vegetables. Having had major jaw surgery, my jaw broken in 8 places, I spent almost 4 months unable to chew food. So then you go, hey, I'm going to go on a carnivore diet where I'm going to eat steak all day. Yeah, no, it didn't. But at the same time, I look at it and I go, okay, to me, I feel better. And I know personally, like, that's the path that I want to go down. And it's kind of cool hearing the long term that you're hearing and you're seeing. Because another buddy of mine is not a religious vegan. He's an ultra marathon runner. And he's like, my body does not process meat. And I'm like, well, yeah, your body it needs something it can burn right away because you're running 120 miles a week. He's also a guy I shared a stat with that said, hey, for every hour you spend running, it adds an hour to your life. I'm like, yeah, but you spent that hour running. To each their own. But in this whole, so much people are like, hey, I want to get better. I want to do things. And it comes down to that discipline. And to me, I would go, it's not discipline. Discipline will get you moving Monday morning a few times. And then you go, oh, I got motivation. I got the vision board. I got the goal I want to get to and all this. To me, what I found the most valuable for me in this process has been the why. And I would assume you have seen people come in with gun ho, excited. I want to do this. I need to get fit. I need to do that. And then other people that go, man, I lift up my kids and I feel tired. How do you help people find their why? Or can you help them find their?
Yeah, you can and you must. You can't give somebody their why. You have to get to their why. Part of that is when communicating with a patient, doing what I would call a discovery call, where I want to discover whether or not I can help you, what you need help with. And that goes to asking very specific what questions and how questions. And the what and how questions can be, what else have you done to resolve this? How long have you been dealing with this? On a scale of 1 to 10, how serious is it? If it's a 1 to 4, well, they're probably not having a conversation with me, because you're not going to take time out of your day. Anytime that I have a doctor's appointment, it's not a good day. 1 to 4 is not going to get me in front of anybody. But if it's 4 to 7 or 7 to 10, the motivations are different. And getting to what's important, like if they come in and say, well, I was told I have high cholesterol. All right. Well, that's not your why. You don't feel high cholesterol, and you want to get to somebody's why. So for example, if you're going to try to get to my why, it has nothing to do with, I ride my bicycle, I work out. I don't compete with anyone. I compete with myself, and I don't even try hard. But my number one fitness goal is to not get hurt. Because at 55 years old, I know how long it takes to heal. I've had enough injuries, and I enjoy being physically active so much that I just don't want to get hurt. That's my first goal. My second goal is to maintain my muscle mass and my strength. And I really like, just because I'm a bit of a data geek, my VO2 max is important to me, because I know that that is a marker of all cause mortality. The higher your VO2 max is, the greater your longevity, prospects are. And, it's kind of like, I kind of like having a dashboard. I like to know my VO2 max. I like to know my hang time, my dead hang time. I like to know my maximum farmer's carry. I like to know my hemoglobin A1C and all of my important lab markers. So I use that as a dashboard, and I find my motivation there, because I enjoy going every year to hike across different islands in Greece where my family's from, and where I take my family. I'm not interested. My mom is 87 years old. Her brain is great, thank God, but her body, I mean, every single step my mother takes is like a disaster waiting to happen. It's like every step is a controlled fall, and it's not very well controlled. I'm not interested in that. So my why is very different from your friend who has the 120 miles a week strategy to win races, and he's going to do whatever it takes to achieve those goals. And, one thing we know about athletes is they're not the healthiest people in the world. If you're training to be a great boxer, there could be things you're doing that are terribly unhealthy. It's not about health. You don't become a great boxer because you're healthy. You become a great boxer because you're fit and you have skill, and you're willing to destroy yourself to win. Health and everything. Bodybuilders are a perfect example of that. You destroy themselves to get to that on-stage aesthetic that will allow them to win a competition. So what is the why that they're coming to me with? So I hope I didn't go too much on a soapbox there. I hope I answered your question. But getting to someone's why is one of the most important things in the world. There are some people who are, I mentioned, I have no shortage of patients who have cancer, and they're dealing with it, and they want to be as healthy and comfortable as they can possibly be while they're going through this dilemma. They don't want to go into hospice. They would like to live their days out at home. They don't want to be, numbed by medication in their last few weeks. They want to experience life while they're alive. What is the motivation that somebody has? What are they really trying to do? You give me a 21-year-old kid with gastrointestinal issues, which is running rampant. A 21-year-old kid in college who's drinking beer and eating buffalo wings and having the time of his life, but can't control when has to have a bowel movement, and it's unpredictable, and they have urgency, and they have anxiety around it, and they're developing signs and symptoms of inflammatory bowel disease. Getting to someone's why is really, really important. And you'll know when you hear it. You do have to ask the what questions, the how questions. What does this look like if your problems were completely resolved? If I had a magic wand and I could resolve 3 of the most important things to you right now, what are those 3 most important things? Because they're clouded by all the things that they've heard online. They're clouded by the doctor who told them they have high cholesterol. They're clouded by all this stuff. It's like, wait a minute, what's really important to you? What do you want to achieve by working with me? And those are the questions that get people to say, aha, that's what I want, and I need your help to do it. Or I think I can do it on my own. But it really depends.
I feel like that's a tough one to try and be like, hey, I can do it on my own. Because I feel like by the time we're coming to somebody like you, the on my own is not working. And like you said at the beginning, athletes look to coaches. Not that necessarily the coach has more talent than them. The coach is another set of eyes to look back and see how you're improving there. We're back at the top of the hour now. I have loved this conversation and would love to have many more because I feel like you have an amazing message to give people who are following here. And not only, I mean, if nothing else, I have enjoyed talking with you and enjoyed this time.
So thank you.
Thank you very much.
You got it, pal.